Hi, my name's Kelsey. I'm a registered dietitian, a certified diabetes care and education specialist, and I work at St. Luke's Pediatrics for endocrinology. Okay, so so thanks for having me. I know diabetes management is a big thing that school nurses do, so thank you so much for working with our kiddos. And as you know, um, diabetes is a very complex disease, so it can present a lot of challenges throughout the year. Um, but learning objectives, I'm gonna try to get through this quickly because I know we have another presenter and a case study I want to get to in questions. But hopefully can go through best practices for diabetes management in schools, age appropriate expectations, and then touch on, and Maureen will also touch on kind of the 504 plan, healthcare plan, the diabetes medical management plan, and the ROI, which is release of information. Okay, next slide. So we now manage, in pediatrics, both type 1s and type 2s. And so what we call, there's different ways to manage diabetes. For type 1s, it could be multiple daily injections or it could be a pump therapy. And there's crossover. So you might have type 2, students with type 2 diabetes that are also managed with multiple daily injections, or maybe they're just on long acting insulin, or they could be on pump therapy. And then we add on top of that some other medications, such as oral medications, or now the new classes of injectables like your GLP-1s. So I'm thinking like Ozempic and things like that. And so you may come across patients who are on those medications as well. Ideally, some of those medications that are only taken once a week or things like that, they wouldn't be doing that at school. Um, but certainly, nurses are seeing those students at every day for those multiple daily injections, especially our younger children, maybe not our older children, but yeah. So that's just kind of a little overview of diabetes management. Go to the next slide. So kind of just what's diabetes, what's the success stories that we see? Well, our goal is that the hemoglobin A1C, that average glucose in 3 months, is under or close to 7%. What does that mean? It means that the average glucose is um, about 150. And then we also have a new target in health, for diabetes, and that's we're looking at time in range. So how much time every day do they spend between those glucose values of 70 and 180? And so that's another goal that we're trying to see. And if they are hitting those targets, which oftentimes you can see, and maybe nurses are familiar with the Dexcom apps or the Libre apps or like the receivers that they bring to school. Um, Oftentimes it'll even tell you like what's their percent of time that they're spending between 70 and 180. Um, Also, what we're looking for is just not very many hypoglycemic events. Or if we're having hypoglycemia at school, it's just being addressed quickly, right? They're being treated and it's not becoming an emergency situation. Um, Also, what I think is a success is students carrying their diabetes kit with them and that they prepare for a backup plan. And I kind of put the 504 plan in parentheses because I was thinking like it may be a good idea when you are doing the 504 plan or health plan that you're thinking about, nurses aren't going to be changing out pump supplies, and they're not going to be doing certain things. So, who's going to do that? Who's going to come to the school? Are they going to bring a backup? And is that going to be the student doing that with supervision? So, things like that. Um, of course, having a fantastic support system, diabetes can be a very um, tedious disease, and the more support they have from their friends at school, school nurses, school staff. I think that's really important. And then, just the accommodations that we facilitate for students at school. And again, healthcare plan, 504 plan. Um, so yeah, so that's kind of our diabetes success goals. Go ahead and go to the next slide. And so when we think of like best practices, we actually encourage all the students' diabetes supplies to go from school and back home every day. Um, but saying that, and every student is different, and every student comes from a different background, and there may be certain challenges. And so we do anticipate that there's going to be those situations and those students who may need extra support. So you're storing insulin at school, you're storing their glucagon emergency medication. But ideally, we encourage students to be taking that medicine back and forth from school to home. And if they want to keep some backup emergency glucagon at school and things like that, that's totally fine. Um, the reason we encourage this is because of um, the way we write prescriptions and insulin, they all have expiration dates. Insulin has an expiration date, 28 days out of the fridge. Um, Glucometer strips expire, everything expires, right? So, but again, there's always going to be those cases where keeping insulin at school or keeping some supplies at school for certain students is going to lead to more success for them. Um, and then just really checking for, from our perspective as a healthcare provider, we want school nurses to really encourage those healthy healthy behaviors and diabetes management. So are you checking the dates on the insulin? Are they dating their insulin when they pull it from the fridge? Are they dating their glucometer strips? And the ketone strips, just little things like that to encourage good self-management skills. And then one of the other thing about diabetes supplies is, are they secure? Are they kept in a secure location? Probably with the nurse, the kid usually has a lot of their supplies on them. Maybe they leave it at the nurse's office. As they get older, and they're not wanting as much help from the school nurse, I think this is where it's more of an issue. It's like, are their diabetes supplies secure from other kids? And do school nurses have access to their emergency glucagon? Next slide. Okay, so just checking a diabetes kit at arrival. I know this probably doesn't happen with every kid who has diabetes, but certainly, addressing the issue before school's, hours into school to find out they didn't have their insulin or they don't have a way to give their insulin, um, their glucometer, just like the supplies that they need. So these are just the basic diabetes kit um, for most of our type 1 kiddos and maybe type 2s. Okay, next slide. So here's our kind of, what we recommend. We recommend glucose checks. Again, this is dependent on every kid. You may not be seeing some of those older kids in your office all the time. But certainly knowing what their glucose is on arrival can tell us a lot. If it's 300 or 400 or if it's low. Um, and then of course, before meals and snacks, PE, recess, signs and symptoms of hypoglycemia or hyperglycemia. Sorry, the print is really small. And then for those kids who are taking the bus home, we do recommend that they're getting glucose checks before they get on the bus. Okay, next slide. I mean, as we all know, kids, um, there's just their age, school age children, they grow so much from pre-K to high school. And we expect a lot more from them when they're older for sure for diabetes management. But for those pre-K to 6th grade, we are encouraging the parent or child drops off their kit to the nurse's office first thing. Unless they're keeping some of those items with them in the classroom, that's fine too. Nurse, we assume that the nurse is assisting with blood glucose checks, carb counts, dosing calculations, injections. Um, Child may receive a reminder to pick up kit before school is dismissed so they don't forget. Um, and I think here's the big thing with the diabetes. Technology is such a huge thing with diabetes now. We have continuous glucose monitors, pumps, and it is standard of care now. And we do want patients on these technologies for safety reasons. Um, but what we're getting a lot of feedback from in the clinic is that the alarms go off a lot. And so I think having that discussion with parents and the child and the school, we're trying to help kids determine what alarms, they should be setting, the targets that they should be setting them at. And you can't turn off hypoglycemic alarms on any device. So you're going to get a hypoglycemic alarm. But do they need to be alerted every time their blood sugar is 200, right? Like after they eat, and it's going to go off every 5 minutes and things like that. And so I think we're getting, where we call alarm fatigue. We're just trying to encourage because of these children are coming, and they have a lot of peer pressure and they don't want to, have those alarms go off throughout their class time. So I think that's going to be a big thing, is working with parents and kids on helping them troubleshoot that a little bit. Okay, next slide. So again, 7th to ninth grade, the child is becoming more independent. They probably have some technology, CGM or pump. They may not want to keep supplies with the nurse. Our recommendation is that the child actually usually carries their emergency glucagon on them if they're not bringing the kit to the nurse. However, if the nurse or if the school feels more comfortable having the emergency glucagon in their office so they have it, I mean, I can understand that too. So we kind of talked, as a group the other day, and there's just always going to be different situations and what you're comfortable with. Um, and I think either is acceptable. Um, this is kind of the age group where we're having difficulty with accurate carb counting, bolusing for meals may be inconsistent. Certainly, eating disorders may arise. So, omitting insulin will often, diabetics will lose weight. They're more embarrassed about their diabetes, about the alarms, about their devices, things like that. Um, Truly, I feel like like the nurse, those students who don't want to come into your office all the time and check in, I feel like the most important thing is just build a positive relationship with the student and just check in with them. Just be their support, um, and maybe build a relationship with the family, and be there when they need. Okay, next slide. Pretty much the same thing. Um, High school age kiddos, poor backup planning is a new one that I put up here. So oftentimes they just start choosing to forget things to bring to school and things like that. So just building those good diabetes self-management skills for that age group is important. And reminding them of the importance of having a backup plan because life happens and things fail and you got to have a backup when you're a diabetic. So yep, same things as the last slide. So go ahead and next slide. So yeah, last session There was a question, I thought it was a good question about the 504 plan and the healthcare plan. So, yeah, so that's a good point that the school plan that we write can be treated as the 504 plan. And certainly, you know, as a provider, we can put in those little things that, come up throughout the school year. Oh, well, you know, someone has recess after lunch and they want the parents want us to give them half a dose of insulin, or something like that, so they don't go hypoglycemic. We can always include little things like that in the healthcare plan as well. And then for us, like, one of the more, like, really important things is we love talking with school nurses. We love to be a part of their healthcare, these students. And so having a release of information form on file every year is so important because we actually do check to see if that is up to date every year and make sure it's in their chart. And so if it's not filled out, um, then it just becomes more of a process to try to get you the information that you want and that you're requesting, which we're happy to send you. It just has to be completed. Um, and then, of course, like the key points, the goals for students with type 1 diabetes, we're just trying, we want them to, we want to minimize time spent outside the classroom managing their diabetes. We want to minimize hypoglycemia, and we want to help adjust those device sounds and alerts, to best assist them while they're in class. And then, of course, encourage and develop those self-management skills. All right. Here's just, I was just going to go through this. Here's the release of information for St. Luke's is always changing, but I did put a link up there for the current one. But any release of information that you have at the school, as long as it's filled out correctly, will be just fine when you fax that to us. Um, and then, of course, that diabetes medical management plan. Some of you may be familiar with that. It is a very detailed management plan, and we love it. But as healthcare providers, we can't complete that form. So we just ask our families to, if they complete that form and send it to us, we will review it and sign off on it, and then send it back to the school. And then the 504 plan is just that standard 504 plan from the ADA.
Thank you,
And
Kelsey.
I'm going to hand it off to Maureen.
Hey, thanks, Kelsey. Thanks for inviting me to help present. I'm a school nurse with West Ada School District. Primarily been working with elementary for the last 11 years. And I got assigned the task of updating our diabetes documentation over the summer when I was working with Surobsky and the summer school program. So that's how I became the diabetes expert, which I'm not. I'm the total learner. And happy to help present our approach at West Ada. The learning objectives that I want to cover from my standpoint, not only to reinforce what Kelsey just presented, was just more about the role of school health services, not just with diabetes, but specifically today with diabetes, and who the health services team are that we consider in development of that plan. Just kind of restate the nursing process a little bit. I'm probably preaching to the choir for most of you, but it really does come into play with diabetes planning, and then talk about the 504 versus just a health plan or IEP differences. Next slide, please. The next couple of slides are taken just exactly from the World Health Organization and from the National Association of School Nurses, as well as West Ada's approach to school health services. And I'm going to read these because I think they're important, and it kind of frames how we look at all conditions for students. But health services in school setting is a specialized holistic practice of nursing, which supports health, well-being, and the ultimate educational success and lifelong achievement of the students. It's done to enhance education, rather than to the detriment of education, being ever mindful of providing health services at times to minimize the negative impact of instruction. So that goes to the fact that we want to design our interventions and our cares so that we are not impeding instruction time for students as much as possible. Next slide. To do this, we coordinate with students, parents, and their providers to develop health action plans and implement necessary life-saving measures for chronic medical and mental needs to maximize the educational instruction while ensuring safety at school. Again, this applies to any medical condition or mental condition. Next. And then licensed nurses in particular participate in special program meetings like the 504 and the IEP meetings and the multidisciplinary team meetings to assist the whole team in identifying individual educational accommodations that might be necessary for students with a medical or mental condition. Next. Our goals and the way we support students, and a lot of this reiterates what Kelsey said. We want to be able to provide a safe and supportive environment for all students. In particular with diabetes, we want to help them improve their own management of their type 1 diabetes and type 2 actually. We want to make sure that we are limiting time out of the classroom as much as possible so that they are in instruction time as much as possible, which will contribute to improved academic success for the student and allow for participation in activities that they choose, as well as improving the quality of life and their mental well-being. Next slide. So in order to do this, as part of that team, the team not only is just the school team, but obviously the student, the parent, and the healthcare provider. And I think the way that it works best, or when it works best, is that when everybody's strengths and their weaknesses as part of this team are put into play and put into motion, so that one person's strengths, like for instance, the doctor's knowledge and the healthcare provider's knowledge of the condition and the treatments, will balance out a weakness in that knowledge that a newly diagnosed student and their parents might have. And so that coming together of everybody's strengths is really what makes a good, safe plan. So as far as a student, obviously, they're going to go from a beginner to an expert over the course of their lifetime with managing this condition. And it's very age dependent, obviously, as to when they are diagnosed with diabetes. As someone who's diagnosed in high school is already going to have some knowledge of nutrition and math skills and reading labels and things like that, as opposed to, you know, somebody who's in pre-K or kinder who doesn't even know how to read yet. And obviously concepts like carbohydrates are beyond their reach. So obviously very individual. It's obviously a 24/7 diagnosis. We're with them about a quarter of their day, 6 to 8 hours in some cases. So that's a pretty big chunk of time where they're at school of that 24 hours. So it's really important that we are following the plan of care that's currently in place from the provider standpoint. So the student's going to be choosing their food and beverages. They're going to need to understand the relationship between those choices and what it does physically to them and what interventions they need to take based on what they're choosing and the activities that they're involved in. These healthy habits need to be taught to all students, not just students with diabetes. And I think maybe if we could, you know, in my next life, I'm going to come back as a school nutrition expert and be in charge of nutrition for the whole country. And we're not going to have any sugar in the school. But really, I think if we approach it from the standpoint of you're no different in this case with regard to what the nutritional needs are of your body. The impact that they have of the choices is going to be different for you. But everyone needs to make good, healthy choices. I also want to help them understand that it's the arc of diabetes care isn't, I start learning, I know it all, it's smooth sailing, and then it's going to be smooth sailing from here on out, but it's kind of a up and down as they change from toddler to a school child or a elementary child to somebody going through puberty, and what puberty changes are going to do are going to the impact that puberty is going to have on how their body responds to insulin and carbohydrate traces, and going on into adulthood as well. So that parent obviously is also on an education continuum with regard to diabetes from the time of diagnosis to getting their son or daughter to be an independent adult, which is what we want for all of our kids. But they have the same educational needs to understand the diagnosis and the treatment as the student does, and just where they're coming from and their own learning environment, how they learn and respond best to information is something that's really important for us to figure out. And every family is going to be a little bit different. Every family is going to have different economic capabilities. Their insurance might be different. What they have access to might be different. And for us, we need just to be able to meet them where they are. That parent obviously is crucial to the planning that we do at school. They're the ones who fill out the initial information and the registration information that might indicate a diabetes diagnosis of their student. They're the one who's going to be providing updates from the doctor if there's changes to ratios or targets. They're the ones who are going to be actually providing the supplies to the school, making sure that we're going to be calling them for when replacements are needed, or as Kelsey indicated, things expire over time and we need replacements. They're going to be the ones who are signing the consents for that medication and for those treatments at school, as well as the release of information for the healthcare provider. So really important that we start off with a good working relationship, and sometimes those take time to build, as we know. Parents are sometimes the ones who are training the nurses as well on the equipment itself. So not only did the parents have to learn the equipment management when the device was given to the student, but then the parents got to be the teacher and teach the school staff how the equipment is used. Okay, next, let's see, let's talk a little bit about the RN as part of the team. Obviously, the nurse is involved in identifying the student, going from that registration information, then coming up with a plan of care. And to do that, we follow a nursing process, which I'll dive into here in just a minute. We need to communicate the plan of care to the educational staff and any updates to that care. And then we need to revise it with any changes. We need to enter treatment orders, and then document all of our interventions on a daily basis or as they occur. Make sure that our PRN orders are in place for backup care, and then emergency orders are in place as well. And we need to communicate with the healthcare provider for any questions that we have or clarifications that we may have, and that comes through that release of information. The nurse's job is also to train any unassisted, unlicensed assistive personnel or health technicians at the school, and delegate care in accordance with what we're allowed to delegate under the State Board of Nursing rules. So that doctor obviously is pretty important in this whole process, not only diagnosing, but also the checkups that are needed, modifications to treatment as needed, communicating with the school nurse and parents and the student themselves in a manner that not only meets the educational level of everyone involved, but also keeps advancing their knowledge along the way to get them to be independent. The teachers and staff of the school need to be aware of the medical condition. They need to know what their role in the plan of care is, if any, and especially what their role would be as far as identifying emergency needs. They need to also be informed of any classroom accommodations that may be listed in a 504, and that's if there are any related to that medical condition. Next slide. Okay, so really quickly, the nursing process, since we've got a lot of nurses on here, I probably don't need to review this too much, but ADPI is our mnemonic that we use. It's assess, diagnose, plan, intervene, and evaluate, and then keep repeating. This is something we're going to start at the start of the year. Hopefully, we have a few days before the students arrive to get all these plans in order and in the works. So there's a lot to be done at the start of the school year, but especially with students with diabetes, there's generally a lot of changes throughout the year as far as their ratios might change, their targets might change, their type of insulin might change. Like a couple kids who are still on finger sticks and pens, um, going to pumps, so that's going to change the management as well. Um, so we need to identify the students through our assessment process. We need to assess, the nurse needs to assess where that student is in the management, their own understanding of the management of their disease. Sorry about that. Sorry, that never happens. So understand, we need to get a comfort level with what the student understands about their condition and their equipment and insulin and all parts of their disease. So are they a brand newly diagnosed person, or are they somebody who's been managing it and are pretty independent? There's such a wide spectrum. The diagnosed part of our mnemonic is not a medical diagnosis, it's a nursing diagnosis. This is where we would identify maybe gaps in education that could lead to a safety issue, need for more frequent checks or more frequent demonstrations of understanding, that sort of thing. So they're nursing diagnosis versus a medical diagnosis. Then we're going to plan and develop our health action plan or emergency action plan or individual health plan. And if necessary, 504 for any academic accommodations. We develop this information from what the parent provides us with our interview with the parent. If we get that diabetes medical management plan document filled out, and for those of you who haven't seen that yet, it's becoming, I think, more common to see it. It's a really good tool. I'll show you an example of it here in the next slide or two. It's very, very thorough. It's something that we have parents fill out at the start of the school year, and you'll see it lists, every aspect of diabetes management. Some of it doesn't apply. For instance, if a student is on a pump versus not on a pump, there's a whole section that is just for pumps. So anyhow, as changes are made to that plan, we are going to update. We're After our plan, we're going to enter our orders, get our medical alert in place, plan our interventions, and actually do our interventions on a daily basis or anytime the student's in school based on the schedule that we set up for meals or activity. And then we're going to evaluate. And evaluate can be kind of a gray area, like we don't evaluate just once at the end of the year. If we're seeing a lot of lows or a lot of highs or some significant trends that are coming up, it's really important that the critical thinking light comes on and say, hey, this is something that I need to bring forward to the healthcare provider at a minimum, or the parents at a minimum, and the healthcare provider as well, to see if there's student needs to get back in to see the provider for some sort of adjustment in their plan. And again, it's a circular thing. It's not a linear plan. It doesn't start here and end here, and we get to the end of the year and we start all over again. It's an ongoing loop. Next. Oh, I'm running late. Okay, so the diabetes medical management plan, I think I also have a link in my um, uh, resource list, and I'll show you a real quick one. But if you look through it, you'll see it's very, very thorough, every aspect of how to manage the student's diabetes. So next plan, we'll just skip right over that. Next slide, thank you. So yeah, these are all the different 7 pages of it, very small print. Obviously, the ending page, it's signed by the physician. It's also signed by the parent. There's a section in there where the parent gives consent for the treatment that's outlined in this plan. So if the parent from Kelsey's, or the provider from Kelsey's standpoint, would rather that the parent fills this out with the nurse, That's great. This is also a really good recap to make sure the parent understands all the different aspects and it's thorough. Um, we can give this last year's plan to the parent so they don't have to completely refill a whole new one out. We can just update it with changes rather than them having to do a whole new one every year. I know kind of they get inundated with forms and requests at the start of the year. Next, please. So do we need a 504? Every student with a diagnosis of diabetes is eligible for a 504. 504 provides academic accommodations. So in elementary, there's not a whole lot of academic accommodations that a student might need because their health plan that we put in place is going to include all of the how we're going to manage the diabetes from a health standpoint. But academically, they might not need any accommodations because they're not doing the state testing, the higher level state testing where you can't have a electronic device without an accommodation. And so somebody on a CGM who might need access to their smart devices would need an accommodation for that state level testing. So that's an instance where it's it's for the academic part of their education, but it's not a health need. So I know it's a little bit kind of a gray distinction, but the health plan that we have in place, the emergency action plan that we have in place, covers all the specific cares. The 504 is for academic accommodations, and it would be things like access to their device during testing, um, um, the timing of when testing for blood glucose and insulin prior to an exam might need to take place. Access to the nurse's office during testing if needed. No penalties for missed for absences due to doctor's appointments for this condition. Um, there's a bunch of others that are listed in the link that Kelsey put up there for the 504s for the from diabetes.org as well. Some of those are more medical, and I know some school districts that might manage all of their medical plans on a 504 plan just because they keep them all in one place, and that's perfectly acceptable. Next slide. This is kind of real briefly the different types of plans, what they cover, and who puts it together. So basically, again, the IHP is medical care. The 504 is academic accommodations and special education needs. The 504 is a team approach. It's put together by the team. The healthcare plan is generally put together by the nurse with obviously parent and healthcare provider involvement, but that health plan at school is developed by the nurse and maintained by the nurse. Next. Kind of restating a little bit what I just said. It's a team decision. Sometimes you'll see a doctor's note when we get the diagnosis of they need to be on a 504, and we have a discussion with parents about, okay, well, we're going to manage the diabetes through this whole plan. If they need academic accommodations, great, and we'll definitely they're definitely eligible for that. They're always eligible for 504. Whether or not they actually are on a 504 specific plan is up to the team to decide. Next. It's an example of our emergency action plan. So the information above those two little lines is what the teacher's going to see in our system. Basically a little short blurb, and this is true for all of our students with medical conditions, not just diabetes, but it'll list the date, briefly what the condition is, and what the plan is that the teacher needs to know in the classroom for managing this. Everything below the line is more specific to the plan of care for that student as far as what we're going to be doing for them in the nurse's office or in the health office plan. And next. So just to wrap up briefly again, the key points is that it's a team approach to create and implement a safe plan for diabetes care at school. We follow a pretty specific process, and it's not linear, it's circular. And it may include plans that look or called something different in different schools, but all students are eligible for 504 protection. And I think that's all I had, other than my slides with my resources. On the next one, yep, it's linked to the World Health Organization, School Nurse Association, and the Diabetes Association.